Here are the top 5 contributions that the ancient Greeks made to neurosurgery, coming to you straight from the Temple of Apollo on the island of Delos. Number 1 is trepanation, burr-hole or craniotomy surgery. Now, the Greeks weren't the first to invent the procedure, but they were certainly the ones to refine it and use it for specific indications like traumatic brain injury. Cases of extradural hematoma, raised intracranial pressure, even epilepsy were treated using trepanation back in the times of the ancient Greeks. In at number 2 is Hippocrates. He needs no introduction. Anyone who's become a doctor knows about the Hippocratic Oath. He was one of the first neurosurgeons in the world and actually knew that you have big veins here in the cranial sutures, and drilling across them, so doing a craniotomy or trepanation, would cause massive hemorrhage. Knowledge that we still use to this day when operating. Hierophilos practiced in Alexandria but was trained in Greek medicine. He was the first to anatomically dissect and describe the covering of the brain known as the meninges. Also, the ventricles, those are the fluid-filled spaces, and even dissected and named some of the cranial nerves. Pisistratus, coming in at number 4, described the hindbrain or cerebellum, and even the blood vessels that supply the brain. Last but not least is Galen of Pergamon. Most importantly, he not only described that the meninges were good for protecting the brain, but also nourishing it. He was also the first to describe spinal cord injury, its effects, and ways of rehabilitating patients. P.S. You know all the terminology in medicine and neurosurgery, specifically cranium, dura, guess what? All of them Greek. Follow for more.